Good afternoon, everyone. Welcome to Medical Queens Got Talent, founded by Dr. Jaya Daptardar. Medical Queens Got Talent is offering health and wellness talks by healthcare experts, raising awareness of the health and wellness issues impacting people all over the world. Thank you for taking the time to tune into this presentation about understanding arthritis. My name is Weishali Joshi, and I'm a practicing rheumatologist at St. Francis Hospital in Hartford, Connecticut. The purpose of this presentation is to create an awareness about arthritis and provide a brief understanding of the basic concepts in arthritis. I would like to thank Dr. Jaya Daptardar for giving me this opportunity and using this platform for that purpose. This talk is for educational purposes only. There is no commercial gain or profit from this presentation. About 100 types of arthritis and related conditions damage the joints and often other organs. There are about 1.71 billion people who have musculoskeletal conditions worldwide, according to the World Health Organization. It is the leading cause of work disability, activity limitations, and risk of falls and fall injuries. Low back pain is the leading cause of disability. The CDC projects that because of increasing age and obesity, by 2040, 26% of US adults 18 years or older are projected to have doctor-diagnosed arthritis. Based on these facts and the impact of arthritis, we will be talking a little bit about what is arthritis, the risk factors for developing arthritis, the symptoms and types of arthritis, some common investigations and treatment modalities of arthritis, and when is it important to see a doctor for arthritis symptoms. So here I can show you what a joint looks like. A joint is a point where two bones connect. And if you see, these are the two long bones, and the space here is what we call the joint. The articular surfaces or the joint surfaces of the long bones are covered by what we call an articular cartilage and are also covered by a thin membrane called synovial membrane. This synovial membrane also secretes a small amount of fluid which is present normally in a joint. This lubricates the joint and keeps the movements smooth and without difficulty. Also, there is a capsule that is around the joint, and sometimes, like because there is swelling in the joint, this capsule can get distended and also cause pain in the joint. When there is inflammation, it causes redness, stiffness, and decrease in mobility of the joint, which is caused either by degeneration or by inflammation, as we will see later. The major types of joints are three: the movable joints, the slightly movable joints, and the immovable joints. The movable joints are the synovial joints, which are the joints which we have the maximum movement in. That is the small joints of the hands, wrists, elbows, the shoulders, hips, knees, and small joints of the toes. The slightly movable joints are the cartilaginous joints, which are in the spine, and the immovable joints, which are also called fibrous joints and are in the skull. There are also structures surrounding the joints, which comprise of muscles, tendons, ligaments, bursa, and soft tissues, which all can be involved in arthritis and may be the cause of pain, stiffness, and decrease in mobility. There are several risk factors which predispose one to have arthritis. There age and family history. Women are more affected than men. Any previous trauma to the joint predisposes to formation of arthritis. Any infection, repeated stress on the joint for whatever reason also increases the risk of arthritis. Smoking and weight gain are two risk factors which are modifiable and predisposed to the formation of arthritis. The main symptoms of arthritis are pain, stiffness, and swelling in the joint. There can also be redness if there is a lot of inflammation. There is grating and clicking sensation, which can be felt either in the knees or maybe in the neck. Sometimes we hear it, and also back pain and groin pain. Groin pain also can be associated with problems in the back as well as the hip joints. As the arthritis advances, there is decreased range of motion and difficulty walking. There are, because of the degeneration and inflammation, there can be deformities in the joints as the arthritis advances. There can be associated symptoms in arthritis, which include fever, skin rash, and fatigue. Um, Moving on, there are two types of arthritis, which are degenerative arthritis and inflammatory arthritis, which is important to note. Degenerative arthritis is also commonly known as osteoarthritis. It is the most common form of arthritis. It mainly affects the thumbs, the knees, the hips, the spine, and the small joints of the hands, but it can affect any joint. There are some joints, like the ankles, which are not commonly affected, but are seen in some specific types of population where there is repeated stress to the ankle, like ballet dancers or runners. It is the degenerative arthritis is not caused by inflammation, but wear and tear of the cartilage that lines the joint. Older age, women, genetics like family history, obesity, joint injuries, repeated stress on the joint, bone deformities, and certain metabolic disorders like hemochromatosis are risk factors for developing osteoarthritis. As the arthritis onset or as it advances, it leads to joint pain, stiffness, loss of flexibility, and difficulty walking or bending. Inflammatory arthritis is caused by inflammation in the joint, which I showed you. The synovium, that is the membrane that lines the joint, gets inflamed and causes symptoms and inflammation in the joint, leading to redness, pain, tenderness, and swelling in the joint. The commonest form of inflammatory arthritis that is seen in practice is rheumatoid arthritis, also gout, psoriatic arthritis, Lyme arthritis, which we will discuss a little bit more in detail. There is also a viral arthritis, which is caused either by parvovirus or chikungunya virus and other viral arthritis, which are systemic infections. There is also septic arthritis, which is actually infection of the joint itself and caused by various microorganisms, Staphylococcus being the commonest, and it's usually seen in drug abusers. There is also spondyloarthritis, which is inflammation in the spine, and the commonest type is the ankylosing spondylitis. So let's talk a little bit about rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease, and it is characterized by inflammation of the synovium leading to bone destruction. About 1% of the population is affected with rheumatoid arthritis. It mainly affects the small joints of the hands. They are tender, warm, red swollen joints, and patients often complain of morning stiffness, which lasts about an hour in the morning. Of note, there is a symmetric joint involvement, which means that the same joints in both the hands are affected. The feet joints are affected with it as well. It may have systemic implications where it affects the eyes, the lungs, the skin, and also increases the risk for cardiovascular disease. Fatigue, fever, loss of appetite may be some of the presenting symptoms at the onset of rheumatoid arthritis. Once again, the risk factors include female sex, smoking, age, family history, and obesity. Smoking has been shown in medical literature to be the commonest risk factor for rheumatoid arthritis, and stopping smoking improves the prognosis in rheumatoid arthritis. Psoriatic arthritis is something that is seen if patients have a history of psoriasis. Psoriasis is a skin lesion which is characterized by these like silvery plaques that are seen On the skin, there are nail changes, which are called dystrophic nails. And the arthritis pattern here is that it affects the small and large joints and the spine. And there are these the digits are inflamed and are swollen, called sausage digits or dactylitis. It can cause eye inflammation, cause uveitis. Again, family history, obesity, alcohol use, age are major risk factors for development of psoriatic arthritis. Gout is a sudden attack of pain, redness, and swelling in the joint. It mainly affects the big toe, as you can see here. It is also known as podagra. It can also affect the ankles, foot, wrist. Small joints of the hands are also affected with gout. It is related to increase of uric acid in the blood, and that can be measured as a uric acid level in the blood. Diet which is rich in purines, that is red meat and shellfish, increase the amount of uric acid in the blood and can predispose to formation of gout and gouty attacks. Increasing weight, underlying medical conditions like diabetes also can increase the risk of gout. Medications like diuretics, that is water pills, can predispose to gout. Male sex, alcohol use, especially beer, are risk factors for predisposing to a gout attack. Lyme affects the large joints, and there is like asymmetric involvement. It is related to Lyme disease, which is caused by tick bite and can occur late in the course of the disease. Children as well as adults can be affected with Lyme arthritis, and it is treated with antibiotics. I want to take a brief moment here and talk a little bit about arthritis of the spine. As we've seen before, that is mostly I showed you pictures of the peripheral joints, but I just wanted to briefly discuss the anatomy of the spine, where there are vertebral bodies, and it is the joints are called like facet joints, and also there is this cartilaginous disc which acts as a shock absorber. Arthritis can affect the facet joints and also cause a degeneration in the disc, causing low back pain and decreased mobility of the spine. Again, spine arthritis is degenerative or inflammatory. It can affect the cervical spine, that is the neck, the thoracic spine, the mid-back, lower back, the lumbar spine, and the sacroiliac joints. The causes of spondyloarthritis, which is inflammation, are ankylosing spondylitis, which is characterized by spinal fusion and decreased range of motion, also psoriatic arthritis, reactive arthritis, and arthritis related to inflammatory bowel disease like ulcerative colitis and Crohn's disease. Rheumatoid arthritis can also affect the spine, and it needs caution while undergoing surgery. Rheumatoid arthritis usually does not affect the lumbar spine or the low back. Patients with rheumatoid arthritis need a formal neck pre-op evaluation prior to surgery and anesthesia. Once the diagnosis of arthritis is made, or when you seek medical attention, there are investigations that are done which aid in the diagnosis of arthritis. There are blood tests like blood counts, kidney liver function tests, which are done prior to getting any other investigations. There are specific tests for arthritis, like the rheumatoid factor, the cyclic citrullinated peptide, which are positive in rheumatoid arthritis, and a uric acid level if gout is suspected. Your doctor may also do x-rays of the specific joints. Here I have a couple of x-rays just to bring to your attention. This is an x-ray of the hand, which shows hand joints, and this is an x-ray of the spine, which shows the vertebral bodies. Also, the x-rays can show whether there is joint damage or what is the type of arthritis that is affecting specific joints. An MRI or CT scan can further look for joint destruction, damage with erosions or osteophytes, and joint space narrowing, which may not be obvious on regular X-rays. Also, rheumatologists are now trained to do musculoskeletal ultrasound and may perform a bedside musculoskeletal ultrasound, which also gives some of this information. So the goals of treatment of arthritis are to decrease pain, control inflammation, slow the progression of arthritis, and minimize and avoid disability and joint deformities. Um, it is important to note that there is no cure for arthritis, and it is important to maintain a active and normal lifestyle and to reduce time off needed from work. Also, to prevent and minimize flares with proper treatment and adherence to medications. So while there is no cure for arthritis, there are some things that can be done to decrease the progression of arthritis and to minimize the symptoms. The most important is weight loss. There are some non-modifiable risk factors like our age and gender, but there are several lifestyle modifications that can be made to promote weight loss. Regular exercise, which can involve like walking or swimming, needs to be incorporated in a normal activity of daily living. Also, there are also keeping a healthy diet can promote weight loss. There are no specific diets or health foods that can that have any that have evidence in medical literature to slow the progression of arthritis, but there are certain things that are used like turmeric or over-the-counter chondroitin and glucosamine sulfate, which can provide some beneficial effects. Also, yoga and Tai Chi, as well as some alternative therapies like acupuncture, may be able to help in arthritis. The treatment of arthritis, as we have mentioned, is pain control. There are over-the-counter Tylenol and NSAIDs like Aleve or Advil, which are used to minimize pain. Also, the main treatment modality in a lot of inflammatory arthritis is prednisone or steroids. There are also topical creams that are available over the counter, which can be used over the small joints of the hands or the knees. One of the advantages of the topical creams is that it does not have the side effects that are present when you take oral medications. Also, physical therapy forms an important role in the treatment of arthritis. Physical therapy done on earlier also minimizes the joint pain, and it increases the activity and motion of the joints. It also helps with neuromuscular re-education. Occupational therapy can be done for arthritis in the small joints of the hands. If there are joint swelling and inflammation, then cortisone injections can be done into the joint, commonly done in the knees, the hips, could be in the shoulders, wrists, small joints of the hands, can be injected with cortisone. Also, there are spinal cortisone injections can be done, but that needs a special referral to pain management or a physiatrist. The medical management with specific treatment for inflammatory arthritis includes what we call DMARDs. So DMARDs are disease-modifying anti-rheumatic agents and are prescribed by the rheumatologist. You may have heard of medications like Plaquenil or hydroxychloroquine or methotrexate, which are given for the treatment of rheumatoid arthritis. There is also a large entity of medications or injections called biologics, which have revolutionized the treatment of inflammatory arthritis. So biologics are any medication synthesized or derived from biological sources, and they are also grouped as DMARDs or disease-modifying agents in arthritis. So many of these biologics are used for rheumatoid arthritis, for psoriatic arthritis, and ankylosing spondylitis. Along with the specific treatment and medications used for arthritis, use of assistive devices are also implemented in treatment of arthritis. This is mainly to give stability and to prevent falls and injuries and problems that come along with it, including fractures and other things. A cane, walker, or a brace is commonly used. Braces are available over the counter and can give support and stability while walking. If surgery is required, a referral to the orthopedic surgeon is required, and they can be useful for joint repair, joint replacement, and or joint fusion. So when do we seek medical advice? If there are prolonged and persistent symptoms, then definitely it needs to be evaluated and see whether there is like a cause for arthritis which needs further management. Also, if there is joint stiffness interfering with activities of daily living, that needs evaluation and further management with your doctor. Restriction of range of motion, red hot swollen joint or joints, fevers, night sweats associated with joint pain or back pain that wakes up the patient from sleep at night, all need immediate medical attention. So the rheumatologist, as you can see, there are like several patterns of disease, and the rheumatologist is able to do more investigations, do your x-rays or CT or MRI or a bedside ultrasound, and piece it all together and make a diagnosis which can then be treated with specific treatment, and the overall goal to decrease the disability or the deformities that untreated arthritis can lead to. So I just wanted to give you a couple of resources. The Arthritis Foundation has a few patient handouts and patient education materials, and also our medical society, the American College of Rheumatology, also has several useful resources for the diagnosis, management, and patient education materials on their website. So in conclusion, I would want to point out that arthritis can be degenerative or inflammatory. There are various patterns of joint involvement, and treatment is to be tailored depending on the diagnosis. Lifestyle modifications like eating healthy, losing weight, being active is as important as medical treatment for arthritis. I hope you enjoyed this presentation, and thank you all for your attention, and have a good rest of the day. Thank you.